Hello everyone, this is Gary Anderson. Hope you all doing well. In today's video, I'll talk about diet and hypothyroidism. So if you like the video related to total health, I would like to request you all please do subscribe to the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. When you are hypothyroid, figuring out what to eat can be a confusing process. This can be especially true if you are trying to lose weight or battling symptoms of hypothyroidism like bloating or fatigue. While you may feel overwhelmed at times, try to relax and take one day at a time. Diet play an important role in the management of your disease. So embarking and finding your way on your eating right journey is worth your efforts. These tips and a discussion with your doctor or a nutritionist can set you on the right path. Protecting thyroid function. Goitrogens are substances found in food that may interfere with thyroid hormone production, although this is usually only in people with iodine deficiency, which is rare in the United States. Even so, moderating your intake of goitrogen containing food like raw cruciferous vegetable, for example, broccoli, cauliflower, and cabbage, is a reasonable dietary goal. Of course, it's best to talk with your doctor about the specific servings of goitrogenic foods allowed for you. Generally speaking, though, a few servings a day is likely harmless. Keep in mind that cruciferous vegetables are very nutritious food choices, so avoiding them completely is not ideal. One consideration is to cook these delicious vegetables as heat eliminates most goitrogenic activity. Soya is another goitrogenic food, but soya consumption is a somewhat controversial issue within the medical community. There is scant medical evidence that soya has health benefit and it may be detrimental to thyroid function, especially supplements that contain high doses of soya. It's best to discuss the consumption of soya with your personal doctor, but until that discussion, avoiding high amount of soya is your best bet. Now I'll talk about the losing weight. Some people with hypothyroidism find it difficult to lose weight despite optimal treatment of their disease with thyroid hormone replacement medication. The good news is that under the guidance of a doctor or nutritionist, you can use various dietary strategies to lose those extra pounds. Two example diets your doctor or nutritionist may recommend include counting calories and or restricting calories. For example, the Weight Watchers model, the zone diet, a low-carb protein enriched diet, counting and or restricting calorie intake. In order to lose weight, you should first write down the number of calories you are consuming each day. Then based on your resting metabolic rate and daily caloric requirement, your doctor or nutritionist can recommend how many calories to cut back on. As an aside, be sure to not cut your calories back too drastically. Doing so can cause your body to hold onto stored fat, turning to your muscle for energy. This starvation mode can ultimately slow your metabolism, which translates to a reduction in your daily calorie requirement, creating a vicious cycle of hunger and no weight loss. Then it comes to zone diet. The zone diet developed by Barry Sears, which is a PhD, is a protein enriched low carbohydrate diet that focuses on balancing the body insulin reaction to food. With the zone diet, a person sets up their meals to contain 40% carbohydrate, 30% protein, and 30% fat. More specifically, a person consumes carbohydrates that have a low glycemic index, proteins that are lean, and unsaturated fat. This specific pattern of eating allows for the slow release of insulin within the body, which promotes the burning of fat. Now to the managing symptoms. In addition to lose weight or maintaining a normal body mass index, eating nutritiously can also help reduce various symptoms of hypothyroidism. Now it comes to bloating. Bloating is a common symptom in people with an underactive thyroid gland. In fact, according to the American Thyroid Association, hypothyroidism can cause as much as 5 to 10 pounds of weight gain just from excess water alone. Some of that water weight gain can be in the face, causing puffiness around the eyes, as well as fluid retention and swelling in the hand, feet, and abdomen. Now it comes to the constipation. Another symptom of hypothyroidism that may be eased with diet is constipation. Unlike for bloating, consuming fiber like beans, whole grains, and apples can relieve constipation. Drinking lots of water is also good for maintaining a healthy bowel function. Even so, in addition to dietary changes, some people with hypothyroidism and constipation needs to take an over-the-counter laxative like milk of magnesia or Miralax. Then it comes to fatigue. Some people with thyroid disease still note fatigue despite optimization of their thyroid hormone level after being evaluated by your doctor for other health conditions that may be causing or contributing to your fatigue, for example, anemia or depression. Consider these fatigue easing dietary tips. Drink a caffeinated beverage, coffee, tea every morning. Take a fatigue fighting dietary supplement like coenzyme. Under the guidance of your doctor, consider an elimination diet. Stop eating sugar or dairy, for example. Some people find this increases their energy level. Then it comes to getting proper nutrition. Since nutritional deficiencies may worsen symptoms of thyroid disease, ensuring adequate vitamin and mineral level is a good idea. Then vitamin D is known as a sunshine vitamin because your body makes it when your skin is exposed to ultraviolet rays. Beside sunlight exposure, you can get vitamin D from certain food like oily fish, eggs, and fortified milk and cereals. While vitamin D plays an important role in maintaining strong bones, emerging research suggests it also plays a role in immune system health. The good news is testing for vitamin D deficiency requires a simple blood test. Treatment entails taking a vitamin D supplement, the dosage of which depends on your target level. Now I talk about the vitamin B12. Research suggests that about one-third of people with Hashimoto disease are deficient in vitamin B12, which is a water-soluble vitamin obtained by eating fish, meat, dairy product, or fortified cereals. Vitamin B12 is critical for the production of red blood cells and neurologic function. Now I'll talk about selenium. Selenium is a mineral found in food like Brazil, nuts, tuna, lobster, halibut, and grass-fed beef. Early research suggests that selenium supplementation can improve the mood or well-being of those with Hashimoto thyroiditis. So, along with getting your vitamin D and vitamin B12 levels checked, be sure to inquire about your selenium level, although it is unlikely to be low if you are reside in the United States. So that's all about the weight loss if you have the thyroid. I hope you all liked it. So for all of you guys, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. So before signing off, I would like to request you all please to like, share, subscribe so that your loved ones will get to know more. So that's all. We'll definitely meet in the next video. This is Carrie Anderson signing off. Till then, take care. God bless. Bye bye. Take care.